Hi, I'm Dr. Matt B. with your Emotional Minutes. And today we're talking about chronic pain, and in particular, the psychology of chronic pain. Now, part of my work is that I work in a chronic pain clinic part time. And a lot of times people will say, why the heck am I seeing a psychologist in a chronic pain clinic? Or why the heck is a psychologist even in a chronic pain clinic? What does psychology or behavior have to do with chronic pain? And actually, a lot of patients hear that and they actually start to become very concerned. A lot of patients, can get worried that as psychologists, we might just tell patients that their pain is all in their head or that we're going to take their meds away because of the opioid epidemic and things like that. And really, actually, chronic pain psychologists have been in chronic pain clinics all across the country. And really, the prime reason for that is that pain can have such an effect on people's lifestyles, behaviors they can engage in, behaviors they can't engage in. It can have an effect on their mood and how they interact with other people and family members. And so, really, the reason that psychologists work in pain clinics is to first kind of understand how those things might affect people's pain experience, and then also ways that they can help people with that. So, at least from a behavioral or a psychological perspective, when we look at chronic pain, there's kind of a few key things that we look at. The first concerns activities and lifestyle. Now, understandably, pain can be something that really prevents people from doing things that they really want to do. And for a number of patients, what can happen is that pain leads them to really stop doing all forms of activities or hobbies or work, even in instances where those things might be non-physically strenuous. And as patients kind of pull away from doing a lot of those things, that can really lead them to lose contact with things that give them a sense of enjoyment or purpose or meaning in their lives. And that can put them at risk to experience depression. And so that's the first area we look at. The second area concerns emotions and emotional reactions. Now, pain really can naturally be frustrating, anger provoking, anxiety provoking. And for a number of patients, those emotions can be really difficult to deal with, where they might be experiencing those emotions just constantly, like many, many times a day, and also having difficulties sort of finding ways to cope with those emotions and having a lot of thoughts about how how unfair this really is for them to experience and how difficult it is. And one of the reasons that we look at a lot of those emotional reactions when it comes to pain is what we call sympathetic activation, or activation of the sympathetic nervous system. Now, you don't need to remember that if you don't want to, but really what that means is that if you're experiencing things like frustration, anger, anxiety, often what comes along with those emotions are things like increases in heart rate, increases in breathing, increases in blood pressure, and things like muscle tension. And really, a lot of those things that people can experience with difficult emotions or just stress in general, especially things like muscle tension, can actually hit on certain people's pain and actually make their pain worse or more difficult to experience. And when people experience difficulties in one or both of those areas, either the activities and lifestyle piece or the emotions and emotional reactivity piece, that can just lead them to focus on their pain a lot more. Now, pain is real, it's not all in people's heads, but really that can lead people to just kind of concentrate on their pain when they're always experiencing those things. Their pain is just always on their mind, and that can make the pain experience more difficult as well. So when people experience difficulties with any of those things that I mentioned, typically what we do is we recommend what we call behavioral pain counseling to give people a service to support them through that. And behavioral pain counseling really just looks at a lot of those things that I mentioned and finds ways to help people to experience a sense of meaning and purpose again, to try to limit depression and limit focus on pain. And then also is really trying to help people find ways to cope with the emotional reactions that come up so that they don't also experience as much of the physical things that go along with pain, like I mentioned. And so chronic pain can definitely be something that really is understandably extremely difficult for people. And hopefully that was helpful today to talk about, sort of ways psychologists sort of help support people through those times and through those pain experiences. And so if you have any questions or comments, feel free to put them in the comment box. And again, I'm Dr. Matt B., and these are your Emotional Minutes, and we will see you next time.